In today's episode, we're going to solve 15 UK NMC CBT clinical questions. So far as adult nursing is concerned, if today happens to be the first time seeing my channel, I officially welcome you. My name is Judgement. I'm a nurse by profession and a content creator by passion. If you haven't looked at the previous episodes, I would advise that you go back to my channel and then look at them. I'll leave the link in the description box so that it's much easier for you to find such videos to watch so you can prepare for UK NMC CBT as an adult nurse. As we usually do, I will read the questions as well as the possible answers, and then I will come up to the right answer together with the rationale. So, enjoy.
Let's go. From the war to the screen, yeah, we breaking the scene, teaching the world how to hustle in dreams. From nurses on duty to creators in pain,
There has been a bomb threat at the medical center. The emergency response team informed the staff that the threat is legitimate and service users should start being evacuated. Which of the following should you do? A. Ambulatory patients. B. Bedridden patients. C. ITU patients. And D. Infants. Which of these people would you move first? Going to the options, I can confidently say that the answer is A. Ambulatory patients. So ambulatory patients are patients who can walk, they are very much active in terms of mobility. So you've got to evacuate them first. That can be done as quickly as possible. So that is why the answer is A. The nurse is preparing to make rounds. Which client should be seen first? A. A 1-year-old with hand and foot syndrome. B. 69-year-old with congestive heart failure. C. 40-year-old resolving pancreatitis. And D. 56-year-old with Cushing's disease. Which of these happens to be the right answer? Going through the options, I can confidently say that the answer is B. 69-year-old with congestive heart failure. Why is the answer B? Go to the options, you could see that this patient with congestive heart failure has the potential of getting deteriorated fast. 1-year-old with hand and foot syndrome, that can wait. And the 56-year-old with Cushing's disease. You may be asking, what is Cushing's disease? Cushing's disease is a condition where the body produces too much cortisol because there's an issue with the pituitary gland. So that is something that can wait. But a patient with congestive heart failure may have respiratory issues, and we know when it comes to airway and stuff, there are very important things to consider. So that is something that you have to think about first. A patient becomes suddenly breathless. Observations: respiration is 32 per minute. SpO2 89% on room air. BP 140/85. Heart rate 110. What is the priority nursing action? A. Take a full medical history. B. Apply oxygen and assess airway and breathing. C. Request a chest X-ray. And D. Administer prescribed bronchodilator. Which of these happens to be the right answer? So, going through the options, I can confidently say that the answer is B. Apply oxygen and assess airway and breathing. And the reason is that when you're assessing patients, you're looking at the ABCD system, where airway becomes the priority to check. And you're seeing that, how to look at the parameters on here, SpO2 is 69%, which is way below the target. We're looking at 92 to 98% or 94 to 98% thereabout. But this patient is falling outside that target. So giving that oxygen can help a bit. You also see that your respiratory rate is 32. At the moment, the question has not specified the age of the patient, so we don't know whether it's an adult or a child. But whatever it is, we know the respiratory of an adult should be 12 to 20, and that of a child can be a bit higher. Or the respiratory rate is high. This can indicate that the patient is in respiratory distress. So giving oxygen and assessing the airway to see what is actually happening is very important. Which of the following statements is true? A. Someone is only an abuser if they deliberately intend to cause harm. B. Abuse only happens to children. C. Only people over 70 can be vulnerable. And D. Abuse can occur unintentionally without the person meaning to cause harm. Which of these happens to be the answer? Going through the options, I can say that the answer is D. Abuse can occur unintentionally without the person meaning to cause harm. A diabetic patient with suspected liver tumor has been prescribed with triphasic CT scan. Which medication needs to be on hold after the scan? A. Furosemide. B. Metformin. C. Docusate sodium. And D. Paracetamol. Which of these happens to be the right answer? Going through the options, I can confidently say that the answer is B. Why is the answer D? Let's look at it. So let me explain this in simple terms. Most CT scans require that a contrast is used. One thing you should understand is that CT contrast contain iodine. This can impair kidney function. And you know, kidney is meant to remove excess or waste substances from the body. If the function of the kidney drops, metformin can accumulate in the body. And when metformin accumulates in the body, it can lead to something we call lactic acidosis. This is very life-threatening, but most times it's uncommon. So this is why metformin should not be given after a CT scan. And in case lactic acidosis happens, there are a lot of things that can be obvious. First of all, there will be rapid breathing, abdominal pain, confusion, hypotension, which can be fatal if untreated. So, yeah. A patient with delirium refuses medication. He is disoriented and unable to understand information. What should the nurse do? A. Respect refusal. B. Give medication covertly. C. Assess capacity and act in best interest. And D. Ask family to force medication. Going through the options, I can confidently say that the answer is you've got to assess the capacity of the patient and act in the best interest of the patient. A patient with delirium is confused, is disoriented to environment, to place, and aiming type. So if such a patient refuses treatment, what you've got to do to assess capacity? What this means is that you've got to assess to understand why they're refusing the treatment. Are they able to feed back to you the importance of the treatment they're having? And do they even know the risk for refusing? So you've got to assess all this and probably act in their best interest. You notice a patient is prescribed penicillin, perhaps a documented penicillin allergy. What should you do first? A. Administer and observe. B. Withhold and inform senior nurse. C. Clarify prescription with prescriber. And D. Ask pharmacy later. Which of these happen to be the right answer? Going to the option, I can confidently say that the answer is go to clarify prescription with prescriber. Make sure that whatever medication that has been prescribed is the right one, that it won't impair the safety of the patient. Which patient requires urgent escalation for suspected sepsis? A. Temperature 37.5 degrees Celsius, heart rate 88. B. Temperature 38.9 degrees Celsius, respiratory 24, and confused. C. BB 135, 80. WBC is normal. And D. Pain score 7 out of 10. Which of these happens to be the right answer? Going to the options, I will confidently say that the answer is P. Temperature is 39.9 degrees Celsius, respiratory 24, and patient is confused. So you'll be asking, what is sepsis? When you talk about sepsis, the general idea that should come to mind is infection. We're looking at systemic infection. And what happens, you know, patient will feel feverish, temperature will rise, respiratory will be high, and patient will appear confused. All these are strong indicators of sepsis, and they should be escalated as quickly as possible. An adult patient with learning disability presents repeatedly with injuries. Carers answers all questions. What is the most appropriate action? A. Accept explanation. B. Document only. C. Raise safeguarding concern. And D. Discharge quickly. Which of these happens to be the right answer? Going through the options, I can confidently say that the answer is C. Raise safeguarding concern. Anything that will compromise the safety of the patient and make them vulnerable should be escalated to the safeguarding team for them to look into it. Patient safety is very important, and when a patient with learning disability comes repeatedly with injuries, it is suspected that the patient is not very safe, and as a matter of fact, it needs to be looked into to find out why that is happening. Which intervention best reduces inpatient falls? A. Bed rest. B. Sedatives. C. Individualized risk assessment. And D. Surgeries for all patients. Which of these happens to be the right answer? Going to the options, I can confidently say that the answer is C. Individualized risk assessment. Every patient is unique. What might cause someone to fall will be different from the other. So you've got to do individual risk assessment to find out what is causing the fall. Is it because they are on certain medications? Is it because their mobility is reduced? It is specific to every patient. Population groups at higher risk of having a low vitamin D status include the following, except A. People who have darker skin. B. People who have higher exposure to the sun. C. People who have low exposure with sun. And D. People who cover their skin for cultural reasons. Going through the options, I will say that the answer is B. People who have high exposure to the sun. You see, sunlight increases vitamin D synthesis. So if you're exposed to the sun, it's possible that you may have enough vitamin D. Otherwise, people who have darker skin, people who have low exposure to the sun, people who cover their skin for cultural reasons may have low vitamin D. And it is advised that they look at something to supplement that. What document could help a nurse understand the preferences of a patient with dementia? Choose the correct answer. A. A handover sheet. B. A this-is-me document. C. The most recent discharge summary. And D. The patient's structure. Which of these happens to be the right answer? Going to the options, I can confidently say that the answer is B. A this-is-me document. This is much more of a specific document for such patients to be able to tell who they are, their preferences, what they like and dislike, and a whole lot of that. It's just for you to know much about them, so that at least you can give them the best of care possible. So when a patient with dementia comes to the hospital, they're expected to come with their this-is-me documents, so you know much more about them. General guidance for the storage of controlled drugs should include the following, except A. Cupboards must be kept locked when not in use. B. Keys must not be available to authorized member of staff. C. Regular drugs can also be stored in the controlled drug storage. And D. The cupboard must be dedicated to the storage of controlled drugs. Which of these happens to be the right answer? So, doing what we call the delineation that the secretion that A, which is cupboards must be kept locked when not in use, is correct. B. Cupboards must only be available to authorized member of staff. That is correct. C. Regular drugs can be stored in the controlled drugs storage. So that is outside the box. So let's keep that. And D. The cupboard must be dedicated to the storage of controlled drugs. So D is also correct. So the old answer here is C. Regular drugs can be stored in the controlled drug storage. That shouldn't be sure. The cupboard should be dedicated to controlled drugs only and not any other. When filling a student note for personal values, what steps are taken before the end of the placement? Choose the correct answer. A. No steps required as long as the field is documented clearly in the assessment documents. B. Contact the university and get them to inform the student they have filled the placement. C. A midpoint interview where you are able to give feedback and allow the student to develop an action plan to achieve. And D. Inform the line manager so they can inform the student. Which of these happens to be the right answer? Going through the options, the answer is C. A midpoint interview where you are able to give feedback and allow the student to develop an action plan to achieve is required. The student has failed. It is expected of you to give feedback. Let the student know why he has failed. And probably this should be done at the midpoint session. It's just because you want to make sure that whatever caused the patient to fail has been corrected before the patient completes the placement. Motivational interviewing is best described as: choose the correct answer to complete the sentence. A. A method used to encourage people to adhere to discharge advice. B. A tool used in peer supervision. C. A tool used in approaching staff for development. And D. A method of assisting people with health behavior change. Which of these happens to be the right answer? Going through the options, the right answer here is D. A method of assisting people with health behavior change. A bit about motivational interviewing. It's a person-centered communication approach used to help people change their health-related behaviors by exploring and resolving their own ambivalence. So with motivational interviewing, you want to assist a patient or someone else to change a behavior. So what you have got to do is to help them to find their own reason why they've got to change. So it's much more like you're not telling the patient what to do, but you're making sure that they find why they need to change from such behaviors to be able to live a comfortable life. It's as simple as that.
Let's go! From the ward to the screen, yeah, we breaking the scene. Teaching the world how to hustle and dreams. From nurses on duty to creators in pain.